This is an inexpensive video containing unabridged information that every clinician must have to.
What is dental safety? It is made up of dental practice by a licensed dentist. Infection control is to protect both employees and patients from diseases. For understanding OSHA's bloodborne pathogen standards, most states need 2 CDE per year in infection control. OSHA, which is primarily protective rules and are oriented towards the first part is inspections, the second is emergencies in building and equipment safety, the third is bloodborne pathogen standards, and fourth is hazard communications. HIPAA deals primarily with protecting the dental patient's information. The ADA followed suit in their guidelines. In 2013, the Oklahoma State Department of Health and Tulsa Department of Health published an official report on the first ever investigated and transmission of HCV in a dental clinic during implantology,
which is full-strength bleach before sterilization. Oxygen, nitrous, local anesthetic, Reglan, Decadron, Propofol, Versed, Cleocin were given, but dosages were not recorded. The key factors of this investigation was:
here are some cases of risks, sensitization, infections and deaths. Most are gram-negative rods. Not only do they put patients and employees at risk. Rheinfehler et al. In 1998 stated that a higher prevalence of children infected with non-tuberculous mycobacterium were hospitalized due to contaminated side of the Atlantic pond to the U.S. The ADA said that there are standards of care followed by the field of dentistry in the many needing surgical intervention. Here too, they needed IV antibiotics.
One does not know for sure whether smallpox was purposefully or inadvertently introduced. If it was not for smallpox, the second language in the great state of Texas today would not be Spanish, but be Nahuatl. Miasma theory stated that diseases such as plague, cholera, chlamydia, and many other diseases.
Bias and type of bias is seen by us.
Bias is seen in most aspects of life. In a study comparing the practice of infection control and safety
antimicrobial stewardship. The next few slides address use and misuse of antibiotics on tuberculous infections and did not respond to conventional treatment or antibiotics, but had to be treated with clofazimine of the disease, or there could be a residual effect of the disease, or sometimes even death.
Appropriate disinfection of high-touch ordinal categories, acceptable level of instrument, regular use of germicides but increased wiping down common surfaces, increased frequency of housekeeping. There are 4 types of surfaces we commonly see in dentistry.
Of fever-reducing medicines such as aspirin, ibuprofen.
Vaccinated healthcare worker is exposed to a source who is HBsAg positive. The prescribed treatment is a need
in the air for long periods of time and can be breathed. Even level 1 to level 3
after school. How much can you address or learn in 3 hours? Most CDEs tout that only the meat of the program is taught. On latex
you must take
gloves
care of
such
your
as
hands
nitro
as it is
and
the
vinyl
breadwinner
material.
And you plan to use it in
Luckily,
dentistry for
she was
many
not
years.
allergic to one non-latex devices during use of air abrasion. Use working engineering controls. Let us address these tenets in detail. To the wavelength of the laser being used. They are available as glasses and as ease and shields. The latter is for those using loupes. Always keep 3 laser protective goggles or eyewear to be used by the patient, the assistant, and the operator. High volume evacuator up to 6 inches below the coupling. Head rest and hand rest of the dental chair.
350 TDS in municipal water and in Alvin, Texas, of greater than 1,000 TDS. Scope. This was developed in my lab at Texas A&M College of Dentistry.
In the presence of mature biofilms, if 3 to 4 ppm bleach was used in dental treatment water, they measured in excess. Today, many clinics use Dentapure to treat the dental treatment water. Self-dissolving tablet. I tested this tablet as well. Dentapure, Mintaclean and Blue Tabs are my experience. This very advanced surgical chair had a built-in EKG system, an electrosurgery unit, a curing light, a piezo endodontic handpiece, a Prophy system, a W and H implant handpiece and motor with detachable and decontaminatable suction lines that came off with.
This device was called the AutoSterile and was a part of this Castellini logo. At our school's water lines testing lab, I ran from many
in biofilm control in our test system of our lab. On the same sample lines and possibly the same surfaces, we later studied the line surface
temperature. Blue Tabs or silver dihydrogen citrate is dispensed as a self-dissolving tablets as 2-sized tablet. rate than they are 2A agar. In a double-blinded study that we published looking at the effects of 7 irrigants with chemicals such as citric acid, chlorine dioxide,
instrument reprocessing and sterilization, and it involves instrument reprocessing, sterilization, monitoring with biological
tub and now placed in the ultrasonic cleaner. Instruments must be sonicated or dissecting microscope and photographed for records. The areas of the burrs examined were the shank, shaft. The ultrasonic solution in the device must be degassed. On a monthly basis, the efficacy of the ultrasonic degassation cycle will start, the given sterilization cycle time of a slow or a fast cycle. After the you may have to wait for the true or diagnostic quality of the results for up to 2 more days. Class 6 or emulators measure 3 variables and black strip from a Also, the state's boards of dental examiners blindly follow what is said in the CDC standards. This happens when the association stayed quiet due to losing funding. Indicator which entered the market only ran 150 cycles, and without a problem. You have now completed the full training program on infection control. Addresses the basics, the meat of what a dental team needs to know. That is, implementing a teacher or a trainer in this field. You need a good lawyer who treats the matter, and you will sometimes reduce the fine but will never abate the fines. Many of these clinics have had small. Go to OSHA's website and download a free poster as well. Here are examples of the OSHA Health. Fire safety is an important topic as fires are associated with burns, smoke inhalation, earthquakes, hurricanes, tornadoes, hazardous or toxic material releases, and warnings can help you stay safe if a tornado occurs. 321 OSHA. It's secured during transportation, or during periods in which the cylinders are not in use, or when they are not attached to the line of exposure to chemicals, dust, mist, blood or other body fluids. The emitter gets the electrical power from one socket through a power strip. This is called an overload, or it is an octopus. Steps, stools or ladders at work and have hurt their ankles, rendering them as temporary injured and homebound. Run other tests required and schedule periodic block needle safety system by Piero Pharma, Capua, Italy. This is a product review for educational B, Olney, Maryland, USA. This is produced under the DCS compliance trademark. Once the needle is used on a patient, the contaminated needle can be inserted into the ORBlock system so that its needle is caps. The cap is about 1 centimeter in length. The top of the
exposure determination is required to list all job classifications in the clinic which all employees may be at level of PPE for a given procedure, including respiratory controls, use and maintenance of engineering, classified as regulated waste. In image 3, although the cotton rolls within the circle are not saturated with blood, immunization history including HPV vaccination, their ability to receive vaccination or refusal of receiving vaccination, employee health record should be passed on to a successor. Happened during active patient care, we would know the identity of the source person if it happens during instrument reprocessing on work hours. Training is provided at initial assignment, after changes in tasks or procedures, and annual. Now on we do the overview training of OSHA's Hazard Communication Standards 29 CFR 1910.1200, HCS 2012, and the globally harmonized system in handling STSs from the manufacturer or supplier. Develop a written program to contain the following, or get the DCS manual with the written program and implement it. It should contain the following.
Or you could use third-party National Fire Protection Association, NFPA label. You must decide what is appropriate for your clinic or dental laboratory. You may keep them as hard copies in a binder, or you can store them digitally.
Of what each pictogram means. A dark image of a human with a starfish-like symbol on the chest means health hazard. And finally, number 6 shows the pictograms to use. Here they use the one that shows it is an irritant, corrosive. This video is the third part of our training programs, and is the overview of the Health Insurance Portability and Accountability Act of 1996, or called HIPAA, that is HIPAA. It is not. The next topic is understanding the application of patient privacy during provision of care, such as consent and confidentiality in using and sharing information, patients' rights in accessing or PHI stands for Protected Health Information belonging to a patient. Please go to the HHS website and download the 9-page BA agreement. It could be a healthcare provider such as a dentist, a medical doctor, dental clinic, a referral specialty clinic, dental laboratory, and the pharmacy. Once the practice use your reasonable and educated judgment, ethically, as you are the owner and in the end will be held responsible. While some clinics and clinicians argue on social media that the patient's info belongs to the clinic, it may be a truth, but information still belongs to the patient. You should give it as an acceptable format. They have rights to amend the information as well. What information is protected? What safeguards to be in place for EHR and PH? All CEs and BAs and others including volunteers. Security is scalable from small clinics to large entities. A covered entity, as in this case every dental clinic, should have a process in understanding the threats, vulnerabilities, and risks that the protected health information faces. For administrative safeguards, we should implement policies and procedures to prevent, detect, contain, and correct security violations. During this process, examples of natural would be floods, earthquakes, tornadoes, or landslides. What is not covered under the scope are fax, voice, and telephone, because they did not exist. This is not a one-time task, but an ongoing activity and a dynamic process. Based on the risk ranking, actions must be taken to mitigate the risks.
Is presumed to be a breach of PHI, unless the CE or the BA demonstrates that there is a low probability that the PIC is the acronym for Health Information Technology for Economic and Clinical Health. In practice in Texas, there will be a fine of $250,000. Texas House Bill 300 only for Texas-based dental clinics.